Hi guys, welcome to a new video. Yes, today, video 2, because I didn't make one yesterday. And I wanted to talk about medication and like what I've tried as a chronic pain patient. And yeah, I'd really be happy to receive some feedback from other chronic patients. Uh, and just to know, like what people tried, what they take, combos, get some inspiration. Maybe something is in there for me, but doesn't look really good actually. Well, I started 2006 with ibuprofen, 600 milligrams, which I took 3 times a day until the year 2011 because, the pain relief wore off. And that's when we started to look for something else that might work. So I tried ibuprofen, like over the counter meds would be aspirin, paracetamol. I had aspirin. I think that's like the normal things you buy at the pharmacy. From the doctors, I had ibuprofen 600 because starting at 600, it has to be prescribed by a doctor. So I had ibuprofen 600. I tried ibuprofen 800 milligrams, which I hardly, or let's say rarely, even get prescribed today because it doesn't work anymore like it used to. So if I take ibuprofen 800, it works like 2 to 3 hours, and then I would be ready for a new pill. I tried Novamine sulfone, or I think it's called metamazole or something. I had drops and the pills. I tried diclofenac, but that is like similar to the Novamine sulfone. Also, it's like similar to paracetamol or ibuprofen. And the diclofenac actually doesn't really work that good, and it makes me go to the bathroom like for 2 days afterwards, so that kind of got thrown out really quickly. I tried Tilidine, the drops and the pills. The drops definitely work, but it's under the narcotic law here, so doctors don't really like to prescribe it. The pills I took, I don't know, maybe like 2 years, and they never worked like they were supposed to. They did take like the biggest peak off, but then I still was left with the rest, and that gets frustrating after a while too because you're still in bad pain, even though like the worst peak is taken, but I never really was pain free. Then I tried oxycodone. I tried. I actually even got antidepressants, venlafaxine, for example. I got in hopes that it would help regulate my pain, which wasn't at all. It just helped my depression for a while. Then I got carbamazepine, which is actually an anti-epileptic, which can help against pain, but it didn't help, so that was tossed pretty quick. I tried Arcoxia 90 milligrams. That made my blood pressure rise like crazy, so that was taken off too. But the Arcoxia worked like for 7 days, and then the pain started coming back. So it didn't work like it was supposed to. I tried gabapentin. I took, I think, like 2 years, and that like turned me into a zombie. and didn't help much against the nerve pain that I had. I tried Lyrica, which I took twice a day, uh, 75 milligrams in the morning, 75 milligrams to the night. That didn't have a positive pain relief at all, and it just, like, the side effects were too bad. So I only took that around 6 months, and then I slowly got more, got taken off of it, which I actually have to say, gabapentin and Lyrica was hard to come off of. Gabapentin, actually, I even started reducing in a hospital because the withdrawal symptoms were pretty bad. Same with the Lyrica. That took a pretty long time to get off at home. Um, then I had the oxycodone. Wasn't that helpful. I had a pain pill that's called here Targine, which is also an opiate. Yeah, they worked okay, but since it wasn't like 100% pain relief, the doctors took that away too. Um, the opiates I tried like three to 4 months, and then like I transitioned from the Targine to the oxy. I think it was called oxycodone, actually, just the pill. Then I had the hydromorphine, I think it was called, which I don't even know. Like, I'm happy for the people that it works for, but I don't know. My body kind of like either my body's already so used to the pain that it actually doesn't really react to pain meds, or it's just the fact that maybe how it's dosed or increased that my body never reached a level to where it helped. Um, yeah, and then in between, of course, I started smoking marijuana, which helped the best. And if I smoke, it takes about 5 minutes and I'm pain free. If I have bad days, I'll have to smoke more than once a day, but it takes my pain away. I don't have pain. And the problem with that is, even though our law since this year, January 2017, says doctors are allowed to prescribe it and the health insurance pays for it, I haven't found a doctor that is willing to go through this procedure with me, because if you start smoking marijuana on a prescription, you're automatically enrolled in like a study to see like how it works, how much you need, and the benefits that you have through the marijuana. And I haven't found a doctor that's willing to do that yet. So I bought it illegally, of course, you know, from a dealer. But that helps. Um, my pain doctor, which is an asshole, didn't even want to try to subscribe me. Um, like, I know there are pills that have the cannabinoid oil in it, or drops and stuff like that, but no, I didn't get that. So I've never tried it. So I don't know if it can help me. Because his answer was, well, since you already smoke marijuana, like you already fried your brain away. I was like, okay, well, thank you, asshole. So that fell off the radar. And yeah, since I already went all the way up to morphine, they were like, okay, well, we have nothing else left that we can give you. So now I have high hopes, of course, for this facet denervation that I will be having, because in 2013 I had one PRT in my lower back, and it helped for 3 days. I was pain free, but when I left the hospital, there was no doctor willing to prescribe it to me again because you need like more than one session. At least here in Germany, you get 3. So I was still missing 2 because maybe it would have helped a little longer, but I wasn't fortunate enough to go through that. So now I'm going to try this facet nerve denervation and hope that that helps because the test shots that I got helped. The last one I had helped like 2 weeks, but now since it's worn off, I'm in bad pain right now. Yesterday was the worst day ever. For a long time, I was like just restricted to bed, just got up, to go to the bathroom or do something for my kid. And it was a hard day yesterday. I didn't sleep all night. I slept like this morning about 3 hours, but I'm tired. But my brain is like, "Hello, we're not sleeping yet." So I hope I can sleep tonight. What I do take is a muscle relaxer called Orthothon, I think is the name, which helps good, but it's only for the muscles. But when the muscles aren't that tense, it's like the nerve isn't extra irritated, so it does give a mini pain relief, so I can at least sit. The big problem that I just have are these gliding vertebrae in my lower back, and there's nothing actually that you can do about that except an operation to fuse the vertebrae together, which the doctors are very reluctant to do in my case because they don't know if they fuse them together now, if that would make my spine unstable, because the way that the Klippel-Feil-Syndrome made my spine be to what it is today, it's still stable enough. So those vertebrae are, being monitored, and if it gets worse, one day they probably will have to operate, and we'll see what happens then. But until then, I just have to try and, live with these gliding vertebrae, and it's increased. They move more than they did like 6 months ago, and the pain that's caused through them gliding is increasing. So I'm struggling with that a little. But as for medication, I don't have anything right now, and I'm always wearing my back brace if I have to go out. The back brace is really helpful. But since it, does correct the disbalance that I have, because my scoliosis is like whoop, and everything adapted and adjusted, the back brace kind of makes my body go like in a normal position, and that hurts too. So it's not easy right now, but I'm still positive that there will be something that helps me one day, because medicine is just getting better, and I still have hope. Where do I get the hope? I don't know. But, as long as I wake up every morning, I know I'm blessed. And if I feel my legs, I know I'm blessed. And I know that God is watching over me. And that's a thing that keeps me motivated, of course. And, yeah, we'll just see what happens. And I'll leave it at that for right now. Thanks for watching, and see you guys soon in the next video. Bye, guys.